Good afternoon, Ms. Jones. Hi, my name is Melissa. I'm the nurse practitioner here at the works with the gynecology oncology team.
Great, nice to meet you.
Nice to meet you. So we brought you in for this appointment today because you met with your gynecologist last week, and due to some of the results from that exam, they wanted you to come see our office.
Great.
Okay. So just wanted to go a little bit over your history here. So can you tell me how old you are?
62.
Great. Okay, and what brought you into your gynecologist? Was that you've been experiencing some vaginal bleeding?
Yeah, I've been having some just kind of spotting intermittently for a while now, but recently it's gotten to where I bleed a lot with intercourse.
Okay.
And then the intercourse is pretty painful also.
Okay, that's definitely concerning. All right, and it says here that you've had some difficulty urinating?
Yeah, and it is a little bit painful as well.
Okay. And your legs are feeling swollen?
Mm-hmm, and they're uncomfortable because they're swollen.
Okay.
It just kind of hurts just to put a lot of weight on them.
Okay, all right. And you do have a history of some mild hypertension, but you haven't been taking medication for that?
Right.
Okay, very good. So I see here that you used to smoke, but you quit some time ago.
Long time ago.
Okay. Very good. Smoking is a big risk factor for many cancers.
Yeah.
Good. Okay, and let me see here. So it looks like on the exam that they did find a mass during the pelvic exam.
Yeah.
Okay, so they wanted you to come see us here. We haven't gotten the results back from your PAP yet,
Oh, okay.
or your HPV exam. Have you heard of HPV?
I have. I thought it was, I think I've only heard about the vaccine that was pretty controversial, I think, for a little while. That's all.
Yeah. It came out in 2006, and it was approved for younger girls, so you wouldn't have been able to get it. Have you ever been told that you have HPV or that you've had an abnormal PAP?
No.
Okay, and I do see from your history that it had been some time since you've seen your gynecologist.
Yeah, I went through menopause about 15 years ago, and I just didn't feel like it was necessary after that. I guess I just was under the misconception that if you were no longer menstruating, you didn't have to go to the gynecologist. So
Yeah,
now I know.
Unfortunately, that is a misperception that people have, and so why you're here today is because of the mass we saw. We don't know what it is yet, but because of your symptoms and because of the fact that you haven't been screening quite some time, it is likely that it may be a cancerous mass.
Okay.
The symptoms that you have are very vague, and they don't necessarily indicate that it may be cancerous, so that's why we need to wait for the tests to come back, but we do want to get it looked at and checked out, okay?
Gotcha.
So just to go over a little bit about your social history. So I see you're divorced, but
Yes.
so you've been having some pain with intercourse?
Yeah, I have a new relationship.
Okay, yeah. Okay, and are you having protected sex? No. Okay. So HPV is a sexually transmitted disease.
Oh, okay.
Okay. It's often asymptomatic, and it can lead to cervical cancer. However, it may have been something that you contracted years ago in your relationship with your husband, or it may be something that you've contracted more recently. Cervical cancer is a cancer that develops from HPV infection that over time, it can be over many, many years, it develops into abnormal cells that eventually develop into cancer.
Oh, okay.
And so if you're not attending regular screenings and we don't catch it early, it can lead to cancer, okay?
Thank you.
So I'm going to do a quick assessment if you don't mind.
Sure.
Okay. All right. So go ahead and hold out your hands. I'm going to squeeze my fingers. Okay, good. Good strong grips. Good. All right. Very good. And I'm going to take a listen to your heart. Take some deep breaths for me. And I'm going to take a listen to your belly. Sure. Okay, let's take a look at your ankles here and the swelling you're having. Yeah, I definitely see some swelling. And you said that it is painful?
Yeah, I mean, not too terribly painful, but I can definitely notice some discomfort.
All right. Any other pain anywhere else?
Just the intercourse and then urination.
Okay.
Otherwise, no.
Okay. And your heart was racing a little bit. Are you a little anxious?
Yeah, the white coat makes me
yeah. It can be a little overwhelming.
Yeah.
I understand. All right. And then the vital signs that you got when you came in, looks like your blood pressure was 142/90.
That's about normal for me.
Okay.
That's about what I run typically.
And with the anxiety, it might be up a little bit too. I am gonna make sure that you follow up with your primary care physician. We want to make sure that we're monitoring that closely.
Okay.
You may or may not need medication again at this time. Okay. Let's see. Okay. Any confusion, numbness, tingling?
No.
No fainting?
Mm-mm.
Okay. Any vision issues?
No.
No. Okay, great. See, your heart sounds great, aside from the fast rhythm, which I think is just anxiety.
Sure.
Your lungs sound really clear. I don't have any concerns there. Okay. How's your appetite been?
Normal.
Okay.
No concern.
Okay. You're not having any nausea or anything like that?
No.
No. Okay. How about stools? Are you having regular bowel movements? Okay. Any blood?
No.
No. Okay. And then I know you said urination was difficult, a little painful, but any blood?
No.
No. Okay. Very good. All right. Let's see here. Do you use any sort of assistive devices with walking? I saw you seem to be walking
No. Yeah, I got
fine.
Mm-hmm.
Okay. All right. So very steady on your feet. Okay. Let's see. Skin looks good. Because of the bleeding, one of the things that we worry about is maybe a little bit of anemia because of the blood loss. You don't look pale. Your circulation seems good. Okay. So, but we will want to get some blood before you leave today, just to kind of check your blood counts and stuff, just to make sure that everything's normal. Okay. All right. And you said that you were divorced and you have a significant other. Tell me a little bit more about your support structure you have.
So my boyfriend now is very supportive, and we spend a lot of time together. I have some other family support as well. I have 3 children that are very supportive, so I feel like I have a good system in place.
Very good. And do you have any activities or social type groups that you participate in?
I have a group of girls, and we get together and do like a book club.
Okay.
Yeah.
Good.
They're kind of just friends.
Any church groups or spiritual?
I don't really. I'm not a very religious person. I just kind of do my own meditation types of things.
Okay, well that's very good. I know that with everything going on, that can be very overwhelming. So we want to make sure that you resume your activities that you do, the things that relax you and calm you, with all the tests and stuff that you have going on. Okay.
Sure.
And I know you came to the appointment alone today, but when you attend to the rest of your appointments, just because we don't know at this time, what things are, if it's cancerous or not, we would like you to maybe bring a close friend or a family member with you, okay?
Sure.
It's always good to have that person there to support you and a second set of ears to hear what the doctor's saying, okay? All right. Let's see here. All right, I think that's about it. So, like I said, we've got you down for the biopsy next week, a CT scan, and we should have the results of your PAP and your HPV test by then.
Okay, great.
So we'll have a better idea of what we're looking at, okay?
Okay.
So when you follow up with the gynecologist next week, we will have all those results for you. We can kind of look at what needs to happen from here.
Okay.
The mass that you have is not normal, but we can't really discuss what we need to do about it until we know exactly what we're looking at.
Sure,
okay?
that makes sense.
All right. Do you have any other questions for me?
No, someone's going to come and draw my blood, you said?
Yeah.
Okay, and then I can get my appointments on my way out?
Yes, we're going to have the office assistant up front is going to be setting up all those appointments, write them all down for you.
Okay.
We have a lot of support here. We'll have a social worker call you too, just to make sure that you know where all your appointments are.
Excellent.
So we want to make sure that we don't miss anything, okay?
Great, thank you.
All right. Thank you very much.
Thank you.
I look forward to seeing you again.
Great,
Okay?
thanks a lot.
Thank you.